And to speak further about this is SABC News Foreign Editor Sophie Mokoena, who joins me now in studio. Sophie, we've seen those visuals of WFP resources being doled out to many African countries, a vision that we have become very used to. In COVID-19, I'd imagine that this was an even more important task for the WFP.
Yes, indeed. The World Food Programme received the award today, and I think it is befitting. When you look at what has been happening around the world, you look at countries such as Burkina Faso, northern Nigeria, you look at Yemen, Armenia, and all areas where you have conflict. The World Food Programme was able to deliver humanitarian assistance and also to ensure that they help those who are deployed in those areas. You'll be aware that during the cyclone Idai in the southern region, that is the SADC region, the World Food Programme was here again to come and assist. And therefore, I think this UN agency has done a lot of work to assist people around the world, particularly those who are in distress. They have also issued lots of reports highlighting areas where there are challenges, for example, the poverty levels and hunger in Zimbabwe, and calling on international community to assist. But for me, what was also critical is the role they played during this pandemic. You know that there are planes that are being used to distribute this food to those areas where you have challenges in conflict areas. But this time around, they were able to deliver medicine, the PPE, and also transport staff of the World Health Organization to go and assist countries that were experiencing challenges of COVID-19. Let's take a listen at what the WHO had to say about this award that has been given to World Food Programme, even though WHO itself was nominated.
On behalf of the staff of WHO, but most especially those of us who work in some of the most dangerous places in the world, WFP not only feeds the hungry, but it moves most of the humanitarian workforce around into the most extreme of environments. And we work very closely with WFP on life support and camps and tents and all of the things that are needed to keep teams in the deep field. So WFP doesn't just feed the hungry, it feeds and protects us in the field as well and allows us to do our job on behalf of those who we serve. So we used to say this in West Africa on other outbreaks, and I'll say it to the world. What we say within the staff of the UN system is WFP rocks. So well done, WFP.
Thank you, Dr. Ryan. I would like to give the floor to Dr. Tedros. Sorry, DG, you have the floor.
Thank you so much. I agree with Mike with the rocks, WFP rocks. And also I would like to add UN rocks, so proud to be UN.
Well, tonight, I guess the Secretary General of the United Nations, Antonio Guterres, is a happy man because these agencies are working very hard to assist the UN to fulfill its mandate, Tsepiso.
Let's talk about global efforts to not only deal with the pandemic. As you mentioned, there's been rising inequality and poverty, and the developing nations and the developed nations are working together to address this. So how is this being dealt with at WHO and IMF levels?
You know that the WHO has started a facility that is assisting in finding a solution, a permanent solution, if one was to call it. Because if you find a vaccine, you'll be able to deal with this crisis of the pandemic. And countries can return back to normalcy, and we can be able to rebuild the economies of the world. But unfortunately, as long as we don't have a vaccine, we are not going to really manage this pandemic. You'll realize later in the report from Europe that our correspondent there will give an update in terms of what's happening in Europe, where it is now becoming winter, where we are seeing the numbers going up again. But today, the IMF and the World Bank and Africa in particular held an important meeting to look at ways and means to assist countries that are in distress. But also at the WHO, there was an announcement made that fortunately China has decided to join this facility, COVAX. It is huge. It is a big story of the day because if you have China within COVAX. China has got facilities, they have the means to assist. They are one of the largest economy, second largest economy around the world, and therefore they will have resources to assist the world to deal with this pandemic, but also pledge money to ensure that a vaccine is found. We know that the United States of America is still outside because they have indicated that they are going to withdraw from the World Health Organization. Let's take a listen at what the IMF, the World Bank, and the WHO had to say about progress made in terms of trying to find a solution to this problem of this pandemic.
We commit to work with countries faced with unsustainable debt. We support the extension of the G20's debt service suspension initiative. Beyond the DSSI, we recognize the need to further strengthen the international architecture for debt restructuring, and we will pursue restructuring on case-by-case basis when necessary. We are encouraged by the strong support of our membership for increasing the Catastrophe Containment and Relief Trust, and we seek to mobilize grant pledges so we can further extend debt relief.
We will make up to $50 billion in concessional finance available in Africa in the coming 3 years as we focus squarely on the road to recovery and on promoting long-term development in Africa. But we all know that to fully confront this economic crisis, we must get the health crisis under control. Acting fast on a vaccine for all is critical. Last week, we submitted to our board for approval a plan to make available up to $12 billion to countries for the purchase and deployment of COVID-19 vaccines.
The more countries that participate in the COVAX facility, the greater the opportunity of being able to roll out vaccines as rapidly as possibly, as fairly as possibly, to reduce the risk of severe COVID disease globally. So the more countries that join the COVAX facility, the more economies that are part of that, the better. So in terms of the timelines, once again, the more countries that join, the better. It's quite simply as simple as that.
Well, I think the person who's happy tonight is President Cyril Ramaphosa, who's the co-chair of COVAX, to see China joining the facility. But I think the fight continues. And secondly, tomorrow, the World Health Organization will hold a special event and activities to look at the mental impact, of COVID-19 to ordinary people around the world. And I think it is a very important event tomorrow because indeed many people are suffering. We see numbers of people who are left out in terms of job, but also in terms of food security, and therefore this does affect people mentally.
Sophie Mokoena, SABC News Foreign Editor, about that important event. Tomorrow is indeed World Mental Health Day. WHO feeling very strongly that governments should invest more money into access to mental health services. Well,